To Pathagonia. This is Jay. Today we're going to talk about the placenta, more specifically acute chorioamnionitis. Thank you to Path Presenter for this slide. So what we see here on low power are the free membranes of the placenta that are rolled up, as well as the umbilical cord. So what does this look in real life? Or not under the microscope. So here we see the free membranes, and on the outer surface it's the chorion, and this lines the inner lining of the uterus, or the decidua. And then inside here is where the baby was, and the lining facing the baby is the amnion layer, and this is the umbilical cord. And the umbilical cord has three vessels, two umbilical arteries that carry deoxygenated blood away from the baby to the placenta, where it exchanges oxygen, and then the umbilical vein takes that oxygenated blood and brings it to the baby. Okay, so on low power, we see this kind of free membrane that's rolled up, and we can see this kind of hypercellular basophilic / dark region. So as we zoom in here, oh boy, this is pretty cellular. With what kind of cells are these? These are neutrophils. So this means there's an acute infection going on, maybe bacterial, maybe fungal. And just for our orientation's sake, so right here, you see this kind of simple cuboidal lining. So this layer is your amnion layer, the layer that faces the baby. And then here is the chorion layer, that roughened area that we just saw. And you should have no neutrophils in either the chorion layer or the amnion layer. So this is acute chorioamnionitis. Really bad acute chorioamnionitis. And this is the mom's response to infection. So these neutrophils are from mom. So now let's go to the umbilical cord, where we see two umbilical arteries and one umbilical vein. And I like to distinguish the umbilical arteries from the vein. Is it kind of has two different orientations of the medial, or the smooth muscle layer of the vessels. Kind of 1, 2, and then the vein just has just kind of like one orientation. So let's go to the vein first. So the vein, this is the baby's blood, and these are the baby's neutrophils, and it marginates or moves from the intimal layer to the media, and you can see these neutrophils. So this is acute venositis, at least. Now, once the neutrophils kind of traverse and journey on to this, what we call the Warden's jelly, then it's called acute venositis, which basically means it's a more serious infection. And let's see if the same thing applies here. So here's the umbilical artery, baby's blood, and we can see some neutrophils here. And it seems like it's traversing. And maybe it's not as bad as the umbilical vein. But regardless, we know that there's neutrophils in the Warden's jelly. So this is acute venositis with umbilical venositis and umbilical arteritis, as well as acute chorioamnionitis. So the risk factors are younger moms, moms who haven't been pregnant prior. Risk factors include like the number of digital vaginal exams, the length of the labor, whether the mom had a history of bacterial vaginosis, whether the mom has a history of what we call group B strep, and some kind of clinical symptoms the mom might have are kind of clinical fever, or may have a fever, may have some uterine tenderness, and the treatment would be maternal, both the mom and the baby having antibiotics. So just to recap, we went over what the free membranes are. You have the amnion layer and the chorion layer, and you should have no neutrophils in either areas. Otherwise, you have acute chorioamnionitis, which we have here. And then we have the umbilical cord, and you have two umbilical arteries and one umbilical vein, and you can get either acute arteritis or venusitis, and if neutrophils go to the Wardenshellii, that's acute phenositis. And this is the baby's response to infection, and chorioamnionitis is the mom's response to infection. So hopefully that helps with your understanding of the placenta. Thanks for watching. If you liked it, give it a thumbs up and subscribe. Until next time, bye.